Jessica grew up in Bridgewater, New Jersey. She graduated from Bucknell University with the BS in biology and a minor in neuropsychology and religion. She has always been intrigued with dissecting the human body, mind, and soul. She's a second year at Rutgers Robert Johnson Medical School, class of 2018, and a student doctor at the Eric B. Chandler Promise Clinic. She enjoys crossword puzzles, Lifetime television, and long walks through the Central Plains. Today, she'll be sharing a story that is unfortunately all too familiar to us, and an epidemic that is ravaging our communities. Please join me in welcoming Jessica Bernstein.
Max and I met in our TWO's preschool class. I'm not going to exaggerate and pretend that I have any memories from that time, but it helps to set the scene. And that's probably when our parents met and decided to be friends. Look at how cute he is. That mushroom cut lived on as a legend till at least 8th grade. Flash forward to 2nd grade. Max and I are both accepted to the Bridgewater AI program. AI stands for Academically Independent. Basically, an accelerated private school sphere for 8-year-old nerds. At 8, Max had already exhibited intellect beyond his age, in reading and writing in particular, as well as science, math, and socially. Being an AI meant that we were segregated from the rest of our class, which made it difficult to make friends, especially outside of our nerd sphere. And after 1 year, Max opted out of the AI program and returned to the normal curriculum. But through Hebrew school and family dinners, we developed a friendship. And although I remained on the AI track through 5th grade, Max accepted me as his friend, and I knew that he was one of the most interesting people that would ever be a part of my life. Our friendship really developed and blossomed over middle school. Max was my first true crush, the first boy that I ever wrote in my diary about with little hearts all around his name. My sister can attest to that. We weren't best friends, not by any means, but I loved Max. And I suppose I thought it was love. But in reality, I had found a brother, someone that I could relate to on so many levels. Max was the smartest and coolest kid that I knew. I was so lucky to be his friend and cherish the relationship that we had. In high school, Max and I no longer had classes together, but it didn't matter because our social friendship had solidified. I don't remember what year it was that I learned that Max was getting high on prescription painkillers and eventually heroin. It's so unbelievable and sad to me now that some way, somehow, it went in one ear and out the other, probably with an accompanying, "Oh wow, that's crazy." At the time, hearing that Max was doing heroin was not the most surprising thing. People were doing it. In fact, a bunch of kids that I knew and hung out were doing it. I mean, I would never do it, because it's heroin. But it was Max. He was the smartest kid I knew. He did better than me on the SATs. He would be fine, and I knew it. He was just experimenting, trying something new, something that most high schoolers do. Well, wait a minute. Let me go back to where I said, I would never do it, because it's heroin. That 17-year-old mentality highlights the stigma that surrounds heroin use. During grade school, we're educated about drinking and other substances through one of those Say No to Drugs programs, as I'm sure most of you were. Heroin is portrayed as this bad and even dirty drug. We're told how extremely addictive it is, how much so that eventually it somehow ruins your life. A drug abused by losers and people living on the street. Going into high school, I assumed that I would never come across it. And when I did, to me, it was more mysterious than frightening. From my experiences, most high schoolers experiment with alcohol and marijuana, despite the warnings that they received in elementary school. Yet most are deterred from the dirty picture of heroin and do not cross that line, whatever that line is. And I found that according to the CDC, my experiences fairly reflect the national data. In 2014, nearly 30% of middle schoolers and high schoolers had experimented with alcohol. 16% had smoked marijuana, and 0.1% had tried heroin. Now that 0.1% may not seem scary, but from 2003 to 2013, the national rate of heroin-related deaths nearly quadrupled. In 2010, New Jersey moved from 41st on the state suffering from drug-related deaths to 18th. And in 2003, the rate of heroin-related deaths in New Jersey was triple that it was nationally. The 5 counties suffering from the highest rates of heroin-related deaths in New Jersey are shown in the darkest blue, and they are Camden, Essex, Monmouth, Ocean, and Middlesex. But as you can see, this plague is well distributed, and no area is spared. And of note, we are currently in Middlesex County. I conducted a survey amongst the student body at Robert Wood Johnson Medical School to see what exposure my classmates have had to heroin and what perceptions they may have regarding patients with a history of heroin use. I got 153 respondents, thanks guys, and 83% went to high school in New Jersey. During high school, 31% knew a friend, peer, or classmate that was experimenting with heroin or other opiates. And 13% knew someone that had gone to rehab for heroin use. In time since high school, that number increases to 32% of knowing someone who has gone to rehab for heroin. And a perfect 33.33%. 1 out of every 3 people who took my survey knew someone who died of a heroin overdose. 75% of 3rd and 4th year students report having encountered a patient with heroin use history in their clinical training thus far, and nearly 50% of them state that they were surprised by one of these patients. Heroin use is on the rise, right here in our backyards, in our friends, our classmates, our families. Yet we seem to experience some disconnect when faced when discussing this topic. I was not surprised to find that the majority of our medical students do not hold any overt prejudices against people who use heroin. 60+% disagreed or strongly disagreed with statements that include people who abuse heroin are homeless, uneducated, minorities, hopeless. But I was surprised by the responses that I received to this statement. My medical education thus far has made me comfortable in relating to and treating patients with a history of prior or current heroin use. Over 40% of 1st and 2nd year students either disagreed or strongly disagreed with this statement. And I believe that this is because heroin is portrayed as scary. And so we are scared to talk about it. We feel as though we want to help, but we don't know how. And when we don't know how to talk about something, when we feel uncomfortable and are unsure of what to say, we don't talk about it. So the issue with this stigma, this dirty, outrageous, mysterious portrayal of heroin, is that heroin use is commonly the evolution of addiction to prescription pain medication. The CDC notes that users of prescription opiates are 40 times more likely to use heroin than others. In addition to the survey that I conducted amongst the medical students, I posted a survey on Facebook where I requested responses only from people with a history of heroin use. I got 8 respondents, ages 23 to 30, 5 of which who went to high school in New Jersey. 75% reported experimenting with non-prescribed use of painkillers prior to trying heroin. The age at first use ranged from 14 to 20, and heroin use followed by less than 1 year to 3 years later. 0% reported first-time use to be intravenous, but over 60% reported eventual IV use. To some of you, it may seem surprising that there are non-IV routes of using heroin, like snorting, which is common. I asked, "What was your intention in trying heroin?" And one respondent freely answered, "To make my opiate addiction affordable." The association between prescription pain medication and heroin use cannot be ignored. And no matter where you are practicing, no matter what specialty, you will come across patients with a history of opiate addiction. In college, Max and I applied to go on Birthright together. You know, that free trip to Israel for Jewish kids after their bar mitzvah. We applied a few times over freshman and sophomore year, but never got accepted. But we kept in touch, sending each other interesting articles that we were reading in our classes. We would hang out when I was home for summers. I would hear stories through the grapevine of Max being in and out of rehab, the hospital. But I never brought it up. Not once did I bring it up. Show my support, voice my concern, smack him across his damn head and ask him, "What the F are you doing?" Or maybe more importantly, why are you doing it? I was so afraid to push him away. I was afraid that he would think that I was judging him or preaching to him or that I thought that I was better than him. I thought he would shut down and not want to be my friend anymore. I didn't know how to talk about it. I felt uncomfortable and I didn't know what to say, so I didn't talk about it. Do you ever have that feeling that something really bad is going to happen? I had that feeling for about 2 years, and after that long, you convince yourself it's got to be in your head because nothing has happened. But on May 12th, 2013, I received the call that Max had died, overdosed the night before. For so many years, we had lived our lives in tandem. Same education, same family background, same religious upbringing. So easily, our lives could have been switched. Max could be here, living his dreams and obtaining success, and me, taken by addiction. Or hey, even both of us in the same place, wherever that may have been. I find motivation in mourning the loss of Max's great and unique potential. He pushes me to never take my own potential for granted, to speak up when I have something to say. So why does this matter to the medical community or to any of you? Interestingly, when I asked the students at RWJMS their opinion on this question, patients who abuse heroin have a treatable medical condition, only 73% agreed or strongly agreed. Shouldn't this be 100%? As we are trained to ask about drinking alcohol and smoking tobacco and other drugs, we should directly ask about exposure and usage of heroin, especially in the adolescent population. And I know, easier said than done. It's not easy to get honest answers about illegal substance use, especially from teenagers. And when you do get the information that you need, there's so much more to it. Finding answers to questions like why and what led to this? What are the best treatment options and maintenance programs? How do I help and guide my patient as they face a medical illness that we do not fully understand? Don't look at me. I don't know. I'm just here to start a conversation, so you can start a conversation with your patients, your friends, your children. It would be easy if addiction were a purely physiological process that we could simply manage pharmacologically, but it is not. Treating addiction is very complex and difficult. But we, as future and current medical professionals, can have a role and make a difference in helping patients with opiate addiction. We need to get over our prejudices, hesitations, and fears because this is a conversation that these patients want to have. From my survey, has a physician ever made you feel uncomfortable discussing your addiction history? 86% no. Has a physician ever put you down because of your addiction history? 100% no. Has a physician ever been instrumental in helping you obtain sobriety? 29% yes. Do you believe that physicians can help patients whom are dealing with addiction? 67% yes, with the rest remaining neutral. Do you feel comfortable discussing your addiction history with your physician? 100% yes. I asked, is there anything you wish that your physician knew, did, or understood better to help you as a patient? Most of the responses related to advocating for therapy, 12-step programs, or support groups over prescribing medication. But the most interesting answer was, I wish that people in chronic pain with a legitimate history of not abusing drugs were not similarly stigmatized as addicts. I feel bad for them. I like to be asked questions because it's hard for me to determine what's important to say. These patients see their physicians as trusted resources for discussing their addiction history because it is their medical history. But they're scared too, and they don't know what to say either. We need to take the initiative to find and ask the right questions. So in closing, I hope to leave you with the message that even though you cannot help everyone, you can save someone. Thank you.